happened before the break for the Introduction to Medical Interpretation 2 class. What we're going to be doing first is go over some typical lines in sight readings in a sight translation that we would like to discuss in the medical setting. These are sort of typical lines that one would expect in a sight translation from English into Spanish mainly. And then what we'll do that for about maybe 40 minutes, 45 minutes. Then we will begin with some practices, some mock examinations. Then we will take our break and then continue with lecture 7 after the break. And at that time, we're going to do some sight translation. I told you in this class that there are some sight readings that I will give them to you in written form before the end of the quarter. And I will do that. I expect to do that in lecture number 9. Most likely you will get that in lecture number 9. That is 2 weeks from today. And it will be all the sight translations that we have not covered. And so far I believe there are 2 or 3 that we haven't done. But today we will be doing one of them. But before we even do one of them, I do want to mention certain things that come out in sight translations in the medical setting that are pretty standard, and we want to discuss those structures as well. For example, one of them is I hereby, and then blah, 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 blah. So, for example, let me give you an example of that. You could say, for example, I hereby sign this consent form and whatever. Okay, so this is an expression that it's sort of a formal expression that has a very interesting translation. The translations for this is por la presente, coma, firmo este formulario de consentimiento. And it continues. But look at the thing hereby, por la presente. Another interesting thing that I noticed that people make mistakes here is that if it says I hereby, you can say por la presente yo firmo, but when you say in Spanish firmo, you automatically know that the pronoun is yo. See, when I say firmo, it's yo firmo. It cannot be él firmo, or ella firmo, or nosotros firmo. So it's common in Spanish to consider putting the pronoun once the verb the verb clearly tells you what the pronoun is. It's sort of considered to be something not very elegant and formal. As a result of it, that could carry some deductions in your exam, particularly if you do it on a consistent basis throughout the exam. So it should be por la presente firmo este formulario instead of yo firmo. Okay. Now you will also see the verb to release. My medical team of any liability or liabilities that may occur, during this procedure. The key here is to release of any liabilities. Now, this to release, in this case, we know that release means, among other things, dar de alta, to discharge, to release, but not in a document that ends like this. The translation for this one is eximo and a mi grupo médico of any liability, de toda responsabilidad civil que pueda ocurrir, blah, blah, blah. So when you see to release of any liabilities, es eximir de toda responsabilidad. Sometimes people say, well, what about it says any here? Can I say de cualquier responsabilidad? It's much more common in formal Spanish when you have any liability or any everywhere, particularly at the beginning of the sentence, to use toda responsabilidad instead of cualquier responsabilidad. It's way more formal. So we want to keep it that way. Now, this comes out also, have you ever had? And for example, have you ever had, let me just give you the whole sentence, any of the following conditions? Okay, this is pretty common. And this one, have you ever had? This ever has to be transfer. So usually in Spanish, we start with ever. Alguna vez ha, and you could use tenido, there's an H, ha tenido. And here we do use cualquiera de las siguientes afecciones. This is fine, this is acceptable. ¿Alguna vez ha tenido cualquiera de las siguientes afecciones? You could transfer this cualquiera to make it sound better is alguna de las siguientes afecciones. You see, this is, we're trying to clean it up so that it sounds better. So we could say, for example, alguna vez ha tenido alguna de las siguientes afecciones instead of cualquiera de las siguientes afecciones. And this is again to show that any very rarely transfers into Spanish as cualquiera or cualquier in sight translation. It transfers either as toda o alguna. So in this case, when you say any of the following, any of is usually alguna de, en vez de cualquiera de. So any by itself can be todo o toda, of course. It could be cualquier o cualquiera. It could be, but this is option 1, option 2. But then if you have any of, is alguna de. And that's the best option. So now we know how that preposition is actually affecting the transfer. So we got to be very careful with that. There is also an interesting thing about the verb. ¿Alguna vez ha tenido alguna de las siguientes afecciones? There is a difference between have you ever had and have you ever experienced in Spanish, as well as in English. If I say, for example, have you ever experienced any of the following pains? Or any of the following whatever. And when you say experience, referring to pain particularly, we use for the verb to experience either sentir o padecer. So, have you ever experienced alguna vez ha sentido o padecido? Now, we use sentido when it refers to pain, and we use padecido when we refers to a disease. So if the experience refers to pain, es sentir dolor. But if the experience refers to a disease, have you ever experienced any of these diseases? Which is odd in English. In Spanish you will say, alguna vez ha padecido alguna de estas enfermedades. In other words, what I'm trying to tell you is when you go from English into Spanish, the padecer works with diseases. Sentir with pain. That's for the verb to experience. And even if it's not to experience, sometimes they say, have you ever had any of these diseases? You could say, alguna vez ha tenido alguna de estas enfermedades o alguna vez ha padecido estas enfermedades. Now, if you use padecer, es padecido estas enfermedades, no de estas. ¿Ha usted tenido alguna de estas enfermedades? ¿Ha usted padecido alguna de estas? So you got to be careful with padecer. Padecer is more like, it's a much more formal term. Okay, for an exam situation, it's a much better term than any other one that you could actually use. The other thing that you may need to be careful, just give me second. Is, yes, go ahead.
We can say alguna vez ha padecido estas enfermedades.
Sí, sí. Padecido, the question is that you don't want to say padecido de, unless you say, for example, alguna vez ha padecido de neumonía, claro. Pero generalmente es alguna vez ha padecido neumonía. You can say padecido de is okay. It's actually, you can use either way. Yeah. To rate is a verb that is used quite often in the medical setting, and it has some interesting meaning, because if you look it up in a dictionary, to rate means so many different things. However, for us, it will always be clasificar. So when I say, for example, how would you rate your general health? ¿Cómo clasificaría su enfermedad, su salud general? It's a really awkward term, because clasificar, the reason why we use clasificar is because when we say how would you rate, the expectation is maybe good, bad, or whatever. And that's what it means by clasificar in Spanish. ¿Cómo clasificaría usted ese dolor? That's important. And when you say clasificar, the answer will be bien, mal, mucho dolor, menos dolor, or whatever the case is, okay? So that's an interesting term too also. It also means evaluar, but that's if it comes from the doctor. So for example, if they say, I'm going to rate your range of motion, voy a evaluar su, and range of motion, by the way, since we are at it, transfers into Spanish is intervalo de movimiento. This word intervalo comes from mathematics, and it really means, and really that's what it is. When they evaluate your range of motion, they're going to say minus 180 to 180, or minus 90 to 90 degrees. And they're basically measuring the angles that you can, how much you can move your arm, for example, like this, if you can move your arm like this, up and down like that, or if you can, there are many different ways that they are rated, but it's always related to a minimum and a maximum in terms of the degrees of motion. So that's what it means by range of motion, intervalo de movimiento, okay? Now, oops, what is that? I don't know, okay. What about this, there is one thing that comes out often, please provide, whatever. You got to be careful with this term. We don't use generally proveer, because proveer in Spanish is this connotation of providing something physical. Le voy a proveer comida, le voy a proveer un lugar donde vivir, le voy a proveer un libro. And it has a lot to do with providing something for someone in exchange for something. So it's not really the best term for the verb to provide. We prefer that you translate provide as proporcionar. Por favor, proporcione. Yes, please provide. Please provide a form before you, a signed form before you leave. Please provide me a signed form. Por favor, proporcióneme con un formulario firmado. Now, sometimes they say something like this, please provide your best estimate, particularly when talking about pain. And this is, if you provide an estimate, a guess, something that it is more like what you think is right, we usually say, por favor, de su mejor dar is the option. If you say proporcione, it's not completely incorrect. We like to use proporcionar when you're actually giving something to somebody. And we like to use dar is when we are sort of providing you with something that is way more abstract, like an opinion. We say, deme su opinión, provide your opinion, deme su opinión. We don't say proporcione su opinión. It's not that common. So now the question is, what will be estimate? Anybody knows? Well, people say su mejor cálculo. No es estimado. No. o su mejor aproximación. It's a very good term. For example, they say, please provide your best estimate of when you experience pain. Por favor, de su la mejor aproximación de cuando comenzó a sentir dolor o cuando comenzó el dolor. So, this estimate es aproximación, cálculo, no es un estimado. Now, you could use something like this. You could say, for example, por favor, estime cuándo empezó el dolor. That's okay. Because as a verb, it's okay, estimar, but not as a noun. Estimación and all that, they become a false cognate for an estimate. Like, for example, when you go to you need to have your car fixed, and they say, well, we're going to give you an estimate. Le vamos a dar un cálculo aproximado, una aproximación de lo que le va a costar. It doesn't mean an exact amount, but it's just an approximation of what you will be paying. If you say, le vamos a dar un estimado, estimado in Spanish, estimado quiere decir dear, like estimado Dr. Rodriguez, dear Dr. Rodriguez. A lot of people say le voy a hacer un estimado, le voy a dar un estimado, pero es una aproximación, un cálculo, it has to give you the idea that it is not an exactamente. No es exacto lo que le voy a dar como la cantidad, pero una aproximación. Now, what about the word provider? We did talk about provide as proporcional, provider. Okay, now here's the problem. We have the typical one is healthcare provider. This one, if you say, for example, proveedor de salud, it sounds like they give you health. Yeah, and they give it to you in your hand, because proveedor, as I told you earlier, is much more physical, it's very, very tangible. Proporcionar salud is that they give you tips to get to feel better. So we don't say either one. We don't say proveer, we don't say proporcional. A healthcare provider, we translate into Spanish as profesional de la salud. Because a healthcare provider can be a nurse, can be a doctor, can be anybody who is in the healthcare industry. And healthcare provider cannot, it has nothing to do with proveer. They're not giving you anything. We are really talking about not somebody giving you something, but rather about someone who gives you his or her services to help you with this issue, maybe, if you want to look at it that way. But that's why it's known as profesional de la salud. Now, sometimes you might have seen prestador de servicios médicos. You may say, why prestador? Well, in Spanish, when you provide a service, es prestar un servicio. And a healthcare provider will provide a service. It doesn't provide anything else. I mean, it's just a service. So yes, you can say, if we're talking about the provider himself or herself, you can say un profesional de la salud, or you can say un prestador de servicios médicos. But generally, this prestador de servicios médicos is referred to maybe the hospital where the healthcare provider works. In other words, for example, Kaiser es un prestador de servicio médico y en Kaiser trabajan los profesionales de la salud. So it will be Kaiser is a healthcare provider, and in Kaiser, there are also healthcare providers, basically, which are doctors and nurses. So in English, when you say healthcare provider, it doesn't distinguish whether you're talking about a place or you're talking about a person who's providing services. Spanish, we do, because prestador is more like the company, and profesional is more like the individual. So, for example, if you get a form and it says, for example, please sign this form and give it to your healthcare provider, you will have to say, por favor, firme este formulario y déselo a su profesional de la salud, which could be your doctor, the nurse, or whoever is in charge of your health. Because if you say al prestador de salud, it sounds you have to give it to the administrative offices of that particular company where these doctors and nurses work for. Okay, that's a very typical mistake, I should say, that needs to be addressed. Okay, be very careful with that. To refuse is a typical term that you may see. For example, I may refuse to sign this authorization, and these are two words, of course. To refuse es negarse, but then it says my refusal. Now here it's, if I say, for example, I may refuse to sign this authorization. Pueda que me niegue a firmar esta autorización. And my refusal will not affect my treatment. Y mi negativa no afectará este tratamiento. These are typical words where people usually make mistakes when they take the sight translation component in the exam. Disclosure. Okay. And usually it's the disclosure of my health information. Disclosure is not, there are two possible translations. Divulgación, revelación. Divulgación is more common. So disclosure of my health information is divulgación de mi información. What is health information? Información sobre mi salud. So you have to work a little bit harder with health information. It doesn't transfer word for word. It transfers more like información. And you have to put sobre mi salud. Okay. All right. Now, the verb to revoke, how would that be used? I may revoke this authorization. Okay. Revoke is simple, revocar. It means you agreed once and now you change your mind. That's what it really means. So if it says, I may revoke this authorization at any time, and this one I want to also point it out, at any time. This is not en cualquier tiempo. Never use time as tiempo. In Spanish, it's almost never tiempo, if you think about it. When in English you say what time it is, we don't say que tiempo tiene. We say que hora tiene, que hora es. You know, it's very rarely that you will use tiempo in Spanish for time. Tiempo is more like the weather or something to that effect. So at any time, you never use en ese tiempo. So you say en cualquier momento. So try to remember that time is momento, and you will always be correct with that. Sometimes it says the revocation is effective upon receipt of this document. Now, we know that revocation is la revocación. And then we have this is effective. ¿Es efectiva? No. ¿Tiene efecto? Maybe. There are many ways you can handle this in a much more elegant way. The revocation is effective. In Spanish dice la revocación entra en vigor upon receipt of this document, al recibir este documento. La revocación entra en vigor, is effective. Good. Okay. Advance directive. You know what it is? An advance directive is what you tell in advance what you want your family members to authorize or the doctor to do for you. And you do this in advance. Typically, people that have Alzheimer's, for example, must have one of those because as time goes by, their cognitive level and memory is greatly affected, and as a result of it, they cannot make decisions on their own. So they have, I mean, it doesn't have to be somebody with a disease. Anybody can have an advanced directive. In fact, it's a good idea. You may get involved into some type of accident. They don't know whether you want to be connected to a tube or you want to die or whatever the case is. So you have to be very specific about what an advanced directive is. In Spanish, we say instrucciones. Y son médicas, generalmente. So we're going to put it within brackets. Por adelantado. That's what an advanced directive is. Okay. In this advanced directive, they talk about your wishes. Some people say sus deseos. It's fine, but also deseos means desires in Spanish. So, for example, you say, well, you have to make sure that, let's see if I have something. Make sure that you name somebody and make sure that she understands your wishes. So, in that context, when you say make sure you understand your wishes, is sus instrucciones is better. Because we're talking about an advanced directive, which we call it instrucciones por adelantado. And when they say, for example, let's say you're going to name somebody or appoint somebody, we'll look at that word in a second, and make sure that you that person understands your wishes, entiende sus instrucciones, más que sus deseos. Porque, por ejemplo, el deseo en español tiene otro contexto. Por ejemplo, digo, yo tengo el deseo de comer chocolate. This is not what it means by wishes. It means more like the wishes that you want. I mean, in Spanish, deseos has this connotation of something physical as well. And whereas these wishes are very abstract because they're things that are going to happen in the future. So you can, preferencias. The question is if you can use preferencias. You could say sus preferencias, but you have to now specify regarding what. So if you say preferencias médicas, maybe that works. Okay. To appoint. Es lo mismo que to name, es nombrar. To name, to appoint is nombrar. So if I say, for example, you need to appoint a family member and make sure that she understands what your wishes are. Asegúrese de nombrar a un miembro de su familia y asegurarse que ella entienda cuáles son sus instrucciones médicas. ¿Ok? Instrucciones médicas. Okay. Discuss your advanced directives or directive with your family members. The first thing that I want to discuss here is family members, miembros de su familia. You could say that, but usually what you will say is sus familiares, okay? So to be in a much more localized, better transfer into Spanish, we will use these familiares. The miembros de su familia is not incorrect, but it sounds like you can become members of a family. In Spanish, it sounds more like miembro es. I mean, it's not incorrect. It's preferable to say hablo con sus familiares. Now, discuss no es discuta o discutir, because discutir is to argue. Es hable, platique. Your advanced directives, sus instrucciones médicas por anticipado o por adelantado, with your family members, con sus familiares. Now, let's look at the structure here. Now we're going to look at a structure. If I say, for example, hable de sus instrucciones médicas por anticipado con sus familiares. This is equivalent to the structure that you have in English. The word order is exactly the same. Discuss, hable, your advance directives, sus instrucciones médicas, por anticipado, with your family member, con sus familiares. But the structure in Spanish sounds very odd, very awkward. Hable de sus instrucciones médicas por anticipado con sus familiares. That doesn't sound right. So what we're trying to do is to restructure this in such a way that it sounds more common, more normal in Spanish. And when we usually say familiares acerca de sus instrucciones médicas por adelantado. So the rule is el verbo plus the who, the people that you're referring to, plus the rest. So if it says, for example, discuss your grade with the teacher. Instead of saying hable de su nota con el maestro, simply it's better to say hable con el maestro acerca de su nota. It's much more common that way, because in Spanish prefers to have verb and then the individual that verb modifies or that is related to the verb right next to each other. We don't want any separation if at all possible. Entonces, hable con sus familiares will be the translation for the proper one for the original. Hable con sus familiares acerca de las instrucciones médicas por anticipado. Por anticipado, por adelantado, they're both correct terms. But the thing that we want to talk about is this structure. When you see a verb and there is also in the structure there is also an individual or a group of people and they are close. I mean, the verb is modifying them or they are related, they are linked, which they always are, by the way. Then you put that first and then you put the rest. So instead of keeping the same word order, so discuss your homework with the teacher. Instead of saying hable de su tarea con el maestro, diga hable con su tarea acerca de hable con su maestro de su tarea o acerca de su tarea. Okay? Is that clear? That's more like a rule, all right? There is also another one, living will. This is an interesting thing because this comes from, we know that last will, que es la última voluntad, and now we have living will. So we usually say voluntad en vida. Oops, voluntad en vida. It's not la última voluntad necessarily, it's la voluntad en vida. And if it says, for example, I direct you to do something, le ordeno que, no le dirijo, okay? Okay. All right. Sometimes they say I'm of sound mind. Now it's more legal now than medical, but it is in advanced directives. And advanced directive has been one of those documents that they have a very high probability of being used in an interpreting exam simply because they are legal documents. And a mistake made in those documents can have some legal consequences. Okay, so we want to make sure that, and you in your lecture 10 you do have an advanced directive, and we're going to go over it here in class. We're going to start in lecture 9 actually. This means estoy en pleno uso de mis facultades mentales. Okay. Another expression, undue influence. Sometimes they say, for example, I'm going to sign this advanced directive, and I I am not acting under pressure, duress, fraud, or undue influence. Undue influence means injerencia indebida. What does it mean? That somebody's telling you what to do. Okay? Usted no tiene ninguna injerencia en este problema. It means you have no room. You have nothing to do with this problem. We don't even accept your opinion. You have nothing to say about this problem. All right? And then they also use the word duress, excuse me. Coacciones en español. And what does it mean? Somebody's forcing you to do something. Like they ask you to sign a document and they put a gun on your, they point the gun at you and they say, you better sign this document. That's under duress. Bajo coacción. That's what it really means. Okay? Okay. Okay. I think we have that done. Let me just do a couple more and then we will finish with this and begin with some more we'll begin with some practices, okay? Now, consultation reports. Now, this is very legal. We know that reports son informes de o sobre las consultas. Okay. Oh, there's one that I forgot to mention. Appropriate box. Sometimes they say, for example, I give my consent by checking the appropriate box, or please check the appropriate box. Okay. Now, first of all, appropriate box is la casilla correspondiente. And now, what about when you say check the appropriate box? There are many ways to explain this, okay? The best way in Spanish, really, in more formal Spanish, is pongo una X, you say X, right? X, en la casilla correspondiente. In a much lower register, you say pongo una palomita. Have you heard that? En la casilla correspondiente. But you see, in this case, check, we don't have a direct transfer of that verb. The verb really is ponga, pero ponga algo más. Ponga una X, ponga una palomita en la casilla correspondiente. Okay. All right. Last but not least is this says the information may be released. The information, of course, remember referring to your medical information, may be released to another doctor or to another healthcare provider. Okay. La información puede ser divulgada. Puede ser, como release, as we saw it earlier, puede ser divulgada a otro profesional de la salud. La información puede ser divulgada a otro profesional de la salud. And one more, I'm sorry that sometimes it said, please do this as follows. Okay, so for example, please indicate the type and amount of information to be used or disclosed as follows. That as follows is really difficult. Como se indica a continuación, please indicate what disease you had as follows. Como se indica a continuación, okay? it's different than it says when you hear at the bottom. Okay, sometimes they say, well, the information that is located at the bottom of this document. At the bottom means al pie de este documento. Okay, we can remove that. Al pie. Okay. Okay, so basically this deals with some structures that are used in sight reading, and when you take the sight translation class next quarter, we will be looking at structures like that so that you can transfer them, without really thinking too much. But you got to really memorize the type of, the preposition that goes between the words sometimes, because in Spanish we may need to put additional prepositions or additional words to make sense of what we are saying, okay? So that's a little bit more tricky. So we will be discussing this later on. This is the only session that we are actually dealing with sight translation basic and material, and then we will be doing some sight readings even today that are in the book after the break today, and you will have a chance of actually using this material. Any questions on this? Okay, we like to do some practices now, so just give me 1 second. I'm going to tell you which is the first practice we're going to be doing. Give me 1 second. Okay, we like to begin with a consecutive practice. Consecutive practice. Okay, so put on your headsets, please, and let's see.
Consecutive. Mr. Sanchez, what brings you here today? Doctora, siento unas agruras muy malas en mi estómago. Además, al despertarme, me siento como norteada y siento el estómago revuelto. Does it happen all the time or just a few times per week? Bueno, yo le diría que me pasa todos los días, en especial cuando como mucho por la noche. ¿Sabe, doctora? Cuando como salsa y tomo jugo de naranja, me agarran más fuerte las agruras. Creo que me afectan mucho. El chochero me dio unos yuyos, pero no siempre me hacen bien. Let's take one thing at a time. Tell me about those herbs. Who gave them to you? Es que no tengo seguro aquí en Los Ángeles y me voy a Tijuana para que me vea un chochero. El chochero es como un médico, pero no tiene título de la universidad. Usa solamente yuyos para curar. Solo me cobra unos $15 por visita. I see. I gather that the medicine man did not take any type of imaging of the stomach or your liver or gallbladder, is that right? No, solo me pregunta cómo me siento y qué me está molestando y me da los yuyos, eso es todo. Well, Miss Sanchez, before I can give you my opinion about your condition, it is necessary to obtain a few images. First of all, I will order an ultrasound of the liver and gallbladder to see if there are any stones present in your gallbladder. Then I would like to order an MRI to see if there are any problems with your digestive tract. Then, after obtaining those results, I will be in a position to give you my opinion on your condition. Meanwhile, let me ask you some questions about the symptoms you feel. Bueno, pues como usted diga, doctora. What type of diet do you follow? El chochero me dijo que no coma tantas salsas y que deje de tomar jugos. Pero yo soy muy necia, doctora, y no le hago caso al chochero. Me gusta mucho la comida y sobre todo la comida grasosa. Además, tengo estos antojos antes de irme a dormir por la noche y me voy a la cocina y me como algunos panes dulces. Creo que eso me hace engordar. Do you go to sleep after eating these sweetbreads? Sí. Do you drink anything at night after going to bed? A veces me como el pan con leche y a veces con jugo de naranja. La leche me hace bien, ¿verdad? Well, milk soothes you for a while, but when the effect is gone, milk actually produces heartburn as much as orange juice does. You should not eat or drink anything before going to bed. How many meals do you have per day? Como el almuerzo y la cena, pero me gusta mucho comer entre las comidas. Estoy siempre comiendo algo durante todo el día. Creo que ese es el problema. Además, vea, doctora, tengo como 30 libras de más y eso me afecta mucho. Being overweight is a problem. However, it does not affect the digestive system. It affects the circulation and other systems, but not the digestive system. My main concern is your diet. Have you ever had any lab tests done? What I mean is whether you know what your cholesterol level is. Pues no. Well, Miss Sanchez, you must have a lab test done today. Your cholesterol level affects your chances of getting a heart attack or a stroke. Let me order a lab test now. Let me see what the results are, and I will see you in 1 week. Meanwhile, take these Tagamet tablets whenever you feel heartburn. By the same token, do not eat fatty food and stop eating salsa and any type of juice that contains citric. I will see you in 1 week. Miss Sanchez. Gracias, doctora. La semana, Dios mediante. End of consecutive.
Terms that were used. Agruras, heart pain, or heartburn actually. Norteado, yeah, dizzy. It also means disoriented. Oh, dizzy. Estómago revuelto, what's that? Okay. Yeah, basically means nauseated, right? My stomach is doing flip-flops. Yeah, that's fine. That's perfectly fine. El chochero, the medicine man. Okay. Chochero is somebody who actually treats patients with jujos, which is herbs. It's an expression that you have problems with. Let's take one thing at a time. Vayamos paso a paso. Paso a paso. I don't know if you remember, but at one point the doctor said, I gather that, and it's something difficult sometimes to transfer. In Spanish that means supongo que. Cuando ella dice que soy muy necia, what's that? Stubborn, right? I'm very stubborn. Soy muy necia. Comida grasosa. Fatty food. Comida grasosa. Overweight es excedida de peso. No gorda o gordo. Okay. Y Dios mediante, God willing. Okay. Now what we're going to do is I'm going to play this same tape, but you're going to interpret that using the simultaneous technique into the opposite language. You can refer to the notes with all the vocabulary. It won't be more than 8 minutes or long or so, but it is really a simultaneous practice. And basically the instructions are very simple. Just interpret into the opposite language. If you hear them in Spanish, interpret them into English. If you hear into English, interpret them into Spanish. Although in the national board doesn't have a simultaneous practice, but this type of practice really reinforces the vocabulary that you learn in class. So, because you really don't have much time to think. The CCHI exam does have a simultaneous, and it's all from English into Spanish. But I think that even a medical interpreter should definitely have some skills with simultaneous in case they are working in ER. So we're going to do this now, okay? So you can refer to your notes. This is simultaneous, okay?
Consecutive. Mr. Sanchez, what brings you here today? Doctora, siento unas agruras muy malas en mi estómago. Además, al despertarme, me siento como norteada y siento el estómago revuelto. Does it happen all the time or just a few times per week? Bueno, yo le diría que me pasa todos los días, en especial cuando como mucho por la noche. ¿Sabe, doctora? Cuando como salsa y tomo jugo de naranja, me agarran más fuerte las agruras. Creo que me afectan mucho. El chochero me dio unos yuyos, pero no siempre me hacen bien. Let's take one thing at a time. Tell me about those herbs. Who gave them to you? Es que no tengo seguro aquí en Los Ángeles y me voy a Tijuana para que me vea un chochero. El chochero es como un médico, pero no tiene título de la universidad. Usa solamente yuyos para curar. Solo me cobra unos $15 por visita. I see. Well, I gather that the medicine man did not take any type of imaging of the stomach or your liver or gallbladder, is that right? No, solo me pregunta cómo me siento y qué me está molestando y me da los yuyos, eso es todo. Well, Ms. Sanchez, before I can give you my opinion about your condition, it is necessary to obtain a few images. First of all, I will order an ultrasound of the liver and gallbladder to see if there are any stones present in your gallbladder. Then I would like to order an MRI to see if there are any problems with your digestive tract. Then, after obtaining those results, I will be in a position to give you my opinion on your condition. Meanwhile, let me ask you some questions about the symptoms you feel. Bueno, pues como usted diga, doctora. What type of diet do you follow? El chochero me dijo que no coma tantas salsas y que deje de tomar jugos. Pero yo soy muy necia, doctora, y no le hago caso al chochero. Me gusta mucho la comida y sobre todo la comida grasosa. Además, tengo estos antojos antes de irme a dormir por la noche y me voy a la cocina y me como algunos panes dulces. Creo que eso me hace engordar. Do you go to sleep after eating these sweetbreads? Sí. Do you drink anything at night after going to bed? A veces me como el pan con leche y a veces con jugo de naranja. La leche me hace bien, ¿verdad? Well, milk soothes you for a while, but when the effect is gone, milk actually produces heartburn as much as orange juice does. You should not eat or drink anything before going to bed. How many meals do you have per day? Como el almuerzo y la cena, pero me gusta mucho comer entre las comidas. Estoy siempre comiendo algo durante todo el día. Creo que ese es el problema. Además, vea, doctora, tengo como 30 libras de más y eso me afecta mucho. Being overweight is a problem. However, it does not affect the digestive system. It affects the circulation and other systems, but not the digestive system. My main concern is your diet. Have you ever had any lab tests done? What I mean is whether you know what your cholesterol level is. Pues no. Well, Miss Sanchez, you must have a lab test done today. Your cholesterol level affects your chances of getting a heart attack or a stroke. Let me order a lab test now. Let me see what the results are, and I will see you in 1 week. Meanwhile, take these Tagamet tablets whenever you feel heartburn. By the same token, do not eat fatty food and stop eating salsa and any type of juice that contains citric. I will see you in 1 week. Take care, Miss Sanchez. Gracias, doctora. La veo en una semana, Dios mediante.
Okay, that was pretty difficult, isn't it? All right, we're going to do a any questions on this? You know the terms, but it's difficult to... Okay, we're going to do a consecutive, and then we'll take our break, okay? And this got the consecutive. So let's do a consecutive.
The results of your lab work are in. It appears that the surgery could take place any time now. I have scheduled the open heart surgery for November 12th at 7 a.m. You will have to be hospitalized on November 9th, and you should expect to be in the hospital for at least 3 weeks.
Me parece bien, doctora. Lo único que espero es que mi nieta pueda estar conmigo para que me cuide después de la operación.
Do not worry about it, Mr. Rivera. We have a well-trained professional staff of nurses that will take care of you. In fact, if you need further help after leaving the hospital, we will send one nurse to your convalescent home or your private home.
Qué alivio. Tenía miedo que no viniera nadie a ayudarme. El periodo de recuperación puede ser muy duro para mí. Le agradezco que piense en mí y que esté dispuesto a enviarme una enfermera.
Let's review the procedure that you will be subject to. First of all, the main goal of this open heart surgery is to free a blocked artery. In fact, I expect to find other blocked arteries. Once we determine which arteries need to be worked on, we will unblock them and then look at the upper chamber of your heart. We suspect that one of your valves does not close completely after each heart pump. So we will take this opportunity to take a look at the valve.
Muy bien, doctora. Me gustaría hacerle algunas preguntas que a lo mejor me darán mayor tranquilidad. Primeramente, me pregunto si el posoperatorio va a ser muy difícil.
Well, it will be, since people usually experience pain in the thorax area for about 2 weeks.
¿Qué probabilidad hay que tenga una recaída?
It will all depend on what we find in your heart. Generally, there is no relapse of any type. We do, however, have to check your pulse, since most people who undergo this procedure experience an increase in their pulse rate. Which can create some complications.
Lo dejo en sus manos, doctora. Otra pregunta que tengo se refiere a mi seguro de salud. Tengo entendido que Medicare va a pagar todo el costo de mi operación. Pregunto si también pagará los servicios posoperatorios.
That I do not know, Mr. Rivera. I believe that your social worker could answer those questions. My main concern is your health and the success of your surgery.
Finalmente, ¿qué probabilidad existe que me quede en la cirugía?
Well, an open heart surgery has its natural risks. However, over 97% of the people who undergo this type of procedure come out of the surgery table without any complications whatsoever. You should be more concerned on the first 45 days after the surgery. The probability of having a serious complication during that period is about 10%. You must do everything I tell you. You must be psychologically prepared for the surgery and the period after the surgery. I am sure that everything will be fine. Do not get anxious about the surgery. I perform over 4 surgeries just like yours per week, and I have never had a patient who suffered critical complications. So, you are in good hands, and you should factor that into the equation.
Yo sé que estoy en excelentes manos. Es que tengo el temor normal de una persona que le van a sacar el corazón y la van a conectar a una máquina para poder seguir viviendo. Todo esto me parece tan poco normal que me hace pensar en lo frágil que es la vida. Y a pesar de confiar en usted y en la medicina actual, le confieso que tengo mis temores.
That is normal, Mr. Rivera, but you should use your common sense and evaluate these things based on the outcome of prior surgeries. And if you do so, you should not be concerned over your surgery.
Del dicho al hecho hay largo trecho, doctora. Es fácil decirlo, pero difícil practicarlo. Que sea lo que Dios quiera, doctora.
Take it easy, Mr. Rivera. Everything will be fine. Will be up and running in less time than you think.
Gracias, doctora.
End of consecutive.
Okay, let's go over some terms here. This was a little bit tricky, to say the least. Huh? Pretty tricky terminology. To free a blocked artery es destapar una arteria bloqueada. Recaída. Relapse. Tengo entendido is in English you base all you say is I understand. It's important to keep in mind when you hear I understand that, you can say entiendo que o tengo entendido que. That's perfectly fine. It's way more elegant in Spanish to say tengo entendido. And then he said something very odd, which you might have not heard. He says, ¿usted cree que me quede en la... ¿Qué posibilidades hay que me quede en la operación? That I die during surgery. Cuando dice, por ejemplo, se quedó en la operación, it means he died during surgery. Okay, that's another way of saying basically se murió. Open heart surgery es cirugía o operación, you could use, ¿sí? Y ese en español es a corazón abierto. No es de corazón abierto, porque si fuese de corazón abierto quiere decir que le cortan el corazón y lo abren. It's a big difference. Es a corazón abierto. It means that you can see the heart. Very different. Outcome. Resultado. Del dicho al hecho hay largo trecho. It's an expression in English. It is easier said than done. It is easier said than done. These are very typical expressions, such as the next one, for example. Everything will be fine. En vez de decir todo estará bien, es muy común en español decir todo saldrá bien. It's much better, actually. Saldrá bien. It is easier said than done. And say you will be up and running in a week or in 2 weeks or something like that. En español esto es volverá a su vida normal. So you see how it doesn't, things don't necessarily transfer word for word. It's just the message that is important. How you structure it in such a way that the message plays, the message is localized. It makes sense in the target language, okay? It doesn't mean you cannot say, usted estará, si you will be up and running, estará despierto, estará, fuera de la cama y corriendo. That doesn't make any sense. Volverá a su vida normal. That's what it really means. You will be up and running. Sí, volverá a sus actividades normales, su vida normal. Any questions on this one?
Can we use cotidiana?
Yeah, you can say su vida cotidiana instead of normal. Yeah, that will be your daily life. That's fine. Any questions? You notice this practice are a little bit more advanced. Did you notice that? Or is it my imagination? It's getting closer to the exam, okay? This is the level, huh? This is the level. We're going to see some mock exams next week and the week after and the week after and so on and so forth until we end with this. And inside translation is all mock examinations. Any questions? Okay, so this is a good time to finish lecture 7 before the break. And we will be taking a break, and then in about 25 minutes we'll continue with the second part of the lecture. Thank you.